Welcome back, everybody. Up to 80% of the population will experience low back pain or neck pain at some time in their lives. Causes include overexercise, improper posture, sports injuries, or degenerative disease. Back or neck pain can affect a person's quality of life, work, performance, and enjoyment of favorite activities, but there is help. Joining us this morning, Rad Payman, a board-certified spine surgeon who will explain the causes of spinal problems and how they can be treated. We want to welcome him to Fox 11 News this morning. So good to see you, Dr. Payman.
Thanks for
coming all the way from Encino and down in the Los Angeles area.
Doesn't take much to convince me to come to San
I know, right?
So,
we live in paradise. A lot of people can probably benefit from this talk that we're about to have because they suffer from maybe back problems, neck issues. Kind of talk to me first of all about how this all kind of comes about.
You know, back pain is very common, and it's one of the leading reasons people go to the emergency room. And typically the main cause is an innocent muscle strain or ligament sprain. And this comes about from lifting something too heavy or twisting while lifting. So a very innocent cause for an injury that can cause significant pain. And so that's the most common cause.
Right. And then, you know, what are some of the options that people have, maybe non-surgical therapies that they can do to kind of combat this pain?
The majority of back pain does get relieved with non-surgical treatments. So typically it's 1 to 2 days, no more, of bed rest, followed by the use of over-the-counter anti-inflammatory medications. And then you incorporate a stretch or physical therapy treatment, even chiropractic care, and usually the back pain responds to these treatments.
Tell me a little bit about your specialty. What exactly do you do, and how do patients kind of come to you for what reasons?
So I'm an orthopedic surgeon specializing in spine surgery, and typically patients that come to see me are people that have been suffering with greater than 2 to 3 months of pain.
Right.
Pain that is not getting relieved with non-surgical treatments such as physical therapy, chiropractic care, massage, even yoga. Medications are not controlling the pain, and the pain is actually getting worse.
Right.
And now it's starting to go into their arms and legs. That's when these symptoms are more serious. When it starts to affect the arms, legs, fingers, numbness, weakness, the radiating pain.
And where does this kind of come from? What are maybe the causes of this? So does this just kind of come about at any time in your life? You
know, it does not. It typically requires an injury or an inciting event. And I have a model here. I mean, the most typical cause stems from the disc.
Right.
The disc is the soft tissue cushion between the bones in our back and neck. And when the disc herniates or protrudes or tears, it tends to irritate the nerves and the spinal cord, which are running down the center and the side of the spine.
Is that when you get a pinched nerve?
That's when you get a pinched nerve. And
Gotcha.
so when we say slipped or herniated disc, pinched nerve, that's what we're talking about.
So talk to me about maybe some ways that people can be treated for something like this.
So typically, again, a few days of bed rest, no more than 2. Use of anti-inflammatories over the counter typically takes care of the problem. Making ergonomic changes at work, correcting your posture, and losing weight. Let's be honest, that's probably one of the most common causes is poor health, right. Poor positioning, and poor muscle strength. And all this can be worked on with a personal trainer, a yoga instructor, or eventually a physical therapist.
So when surgery is required, though, what kind of procedures do you recommend?
You know, surgery, as I mentioned, is the end of the
right.
treatment option, and when it is required, typically a nerve is pinched. So the goal of surgery is relieve the pinching of the nerve, and with the use of our modern day technology now, we're able to do the majority of these surgeries outpatient, where the patient goes home the same day, usually within a few hours. And again, the goal is to relieve the pinch, and with the use of microscope technology, we're able to do 1 centimeter, 2 centimeter incisions with a muscle sparing approach, usually not taking down any muscle, which is typically the cause of debilitating pain after surgery. So now patients are back to work within a few days.
Oh, wow.
The pain is relieved usually immediately.
And spinal disc replacement, is that what you're speaking about right now?
Spinal disc replacement is an option. It's not for everyone. However, it's an excellent alternative to what we've been doing traditionally, which is spinal fusion.
Right.
So it maintains motion. It's a different type of surgery, and as I mentioned, it's not for everyone, but typically consulting with your specialist is usually the best first step to see if you're a candidate for disc replacement technology.
We have about 20 seconds here. How would you like to wrap this up?
I'd like to say, you know, promoting health. Santa Barbara, in driving around all day yesterday, a pretty healthy town.
Right.
And I notice, I actually attend a yoga retreat here just outside of Santa Barbara once a year. I think promoting health, weight loss, and really proper posture and positioning at work, and maintaining a really strong, healthy core. So
making a big difference.
Making a big difference.
Dr. Rad Payman, his office in Encino, California. Thank you so much for joining us this morning. Thank you for joining us here on Fox 11. We'll see you tomorrow.